Hong Kong reports virus death as workers strike at hospitals. Get a load of these beds. Look how many beds. They are preparing big time. Hong Kong hospitals cut services as medical workers were striking for a second day, Tuesday, to demand the border with mainland China be shut completely to ward off a virus that has caused its first death in the semi-autonomous territory. All but 2 of Hong Kong's land and sea crossings with the mainland were closed at midnight after more than 2,000 hospital workers went on strike Monday. As many as 9,000 medical workers could join the bigger walkout Tuesday to demand closure of the border cross, with which tens of thousands of people continue to travel daily. Hong Kong's hospital authorities said it was cutting back services because a large number of staff members are absent from duty, and emergency services in public hospitals have been affected. Hong Kong was hit hard by SARS, or you can call it severe acute respiratory syndrome, in 2002-03, and an illness from the same virus family as the current outbreak. Trust in Chinese authorities has plummeted following the months of anti-government protest in the Asian financial hub of Hong Kong. Also, Tuesday, the leader of a nearby gambling enclave of Macau asked the city's casino bosses to suspend operations to prevent further infections after a worker at one of the resorts tested positive for the virus. Macau has recorded 10 cases in all. The mainland's latest figures of 425 deaths and 20,438 confirmed infections of the new coronavirus were up from 361 deaths and 17,205 cases the previous day. That's a jump of like 3,000 new cases, 3,000 plus new cases. At least 180 cases outside mainland China. At least 180 cases have been confirmed, including 2 fatalities in Hong Kong and the Philippines. The patient who died in Hong Kong was a 37-year-old man who had traveled to Wuhan, the mainland city that has been the epicenter of the outbreak, before being hospitalized. The hospital authorities said Tuesday he had existing health conditions, but did not give details. Most cases of the illness have been mild, but most who have died have been older people with other ailments, such as diabetes or heart disease. China has struggled to maintain supplies of masks to filter out the virus, along with protective suits and other key articles, as it seeks to enforce temperature checks at home. Offices, shops, and restaurants require masks to be worn in public and keep more than 50 million people from leaving home in Wuhan and neighboring cities. To help meet demand, the European Union office in Beijing said member states have shipped 12 tons of protective equipment to China, with more on the way. Might explain why there's no mask around. Late Monday, China's President Xi Jinping presided over a special meeting of the top Communist Party body for the second time since the crisis started, saying, "We have launched a people's war of prevention of the epidemic." He threatened punishments for those who neglect their duties, and that was reported by the broadcast on CCTV. Other countries are continuing evacuating their people out of China. A plane carrying Malaysians from Wuhan arrived in Kuala Lumpur, and the 133 people on board were to be screened and quarantined for 14 days, the maximum incubation period for the virus. Taiwan on Monday flew home 247 of its citizens from Wuhan and had sent 3 passengers for treatment after they were found to have fever or sore throats. The other passengers are being quarantined at medical facilities for the next 2 weeks. Germany's Lufthansa became the latest international airline to suspend flights to China, and several countries are barring Chinese travelers or people who have passed through China recently. In Wuhan, patients were being transferred to a new 1,000-bed hospital that officials hope will improve isolation to stem the virus's spread. It was built in just 10 days. Its prefabricated wards equipped with state-of-the-art medical equipment and ventilation systems. A 1,500-bed hospital, also specifically built for patients infected with the new virus, is due to open within days. Elsewhere in Wuhan, authorities are converting a gymnasium, exhibition hall, a cultural center into hospitals with a total of 3,400 beds to treat patients with mild symptoms of the virus. Television footage of those facilities show beds placed in tight rows in large rooms without dividers or any barriers to keep patients isolated. With no end to the outbreak in sight, authorities in Hubei and elsewhere extended the Lunar New Year holiday break due to end this week, but they extended it well into February to try to keep people at home and reduce the spread of the virus. All Hubei schools are postponing the start of the new semester until further notice, as many in Beijing, Shanghai, and elsewhere. I think that should be as many. Chinese scientists said they have more evidence that the virus originated in bats. In a study published in the journal Nature, Zhen Li and colleagues at the Wuhan Institute of Virology reported that genome sequences from 7 patients were 96% identical to a bat coronavirus. Full coverage. We'll come back to that virus outbreak. On Tuesday, the Korea Centers for Disease Control and Prevention said a 42-year-old South Korean woman tested positive for the virus days after she returned from a trip to Thailand with chills and other symptoms. It is South Korea's 16th case. Thailand has confirmed 19 cases, mostly Chinese tourists, but also a Thai taxi driver. A passenger on the Japanese-operated cruise ship tested positive after leaving the vessel while it was in Hong Kong, and Japanese officials were conducting medical checks on more than 3,000 people on board Tuesday. Let's go look at that virus outbreak. Again, I keep seeing these people with masks and no goggles. Why are we being told goggles? Those hospital workers that just popped up there, watch, it'll pop up again in a minute. They didn't have any eyewear on. They just have hats, masks, and biosuits. Experts prepare, but new China virus is not pandemic yet. Health authorities, again, the guy with no goggles, just a mask. Health authorities are preparing for a possible pandemic as they work to contain a respiratory illness in China that's caused by a new virus. Governments are limiting travel, isolating sick people, and keeping travelers returning from the affected region under quarantine to watch for symptoms. In the United States, the scope and cost of the government response is increasing. U.S. officials already have tapped into a $105 million rapid response fund and notified Congress that they may need $136 million more. Here's what you should know about the illness. Is it a pandemic? Not yet. The virus is an epidemic in China, where more than 17,000 cases have been reported, which we know now is 20,000, but has not affected enough people around the globe to be considered a pandemic. So far, other countries have reported only a few dozen cases, most involving travelers returning from China and their close contacts. And while there have been more than 360 deaths, which we know is 475 now, all but one has been in China. Based on the way the virus spread in China, investigators believe each infection has led to an average of 2.2 others getting sick. That's the RO number, the number of people you come in contact with that get the virus. That's a bit more than ordinary flu, but less than SARS, a genetic cousin of a new virus. Governments are preparing for a possible pandemic and taking actions to prevent one. The World Health Organization designates a pandemic when there are outbreaks on at least 2 continents. So far, WHO has called this a public health emergency of international concern. In 2009, the H1N1 influenza virus reached pandemic level. Now H1N1 is a regular flu virus that circulates around the globe seasonally. What is the new virus? Scientists have identified it as a new coronavirus. The name comes from the Latin word for crowns or halos, which coronaviruses resemble under a microscope. The coronavirus family has many types that affect people. Some cause the common cold, while others, originating in bats, camels, and other animals, have evolved into a more serious illness, such as SARS or MERS, Middle East Respiratory Syndrome. Where did it come from? The first cases appeared in December in Wuhan, a city in central China's Hubei province. Many of the first people infected had visited or worked at the Huanan seafood wholesale market in Wuhan, which has been closed for investigation. Chinese health officials say they believe the illness first spread from animals to people. They now say it can spread between people. What are the symptoms? Common symptoms include fever, cough, shortness of breath. In serious cases, the virus can cause pneumonia. Some patients have needed oxygen. Others only had mild illnesses. It's too early to say whether the new virus will fade out as a cold or flu virus do when the winter ends. If it does, a second wave of illness could start up in the fall. By then, there may be a vaccine to slow it down. How is it treated? The World Health Organization said that there is not a specific medicine recommended to treat the illness, although some will be tested. For now, doctors are treating symptoms with anti-fever drugs. Some doctors are trying antiviral drugs developed for HIV or Ebola. Remember, we heard a report that it was hiding like 4 different viruses inside of it. One was HIV. Now that they're trying antiviral drugs that developed for HIV or Ebola, really makes my hair stand up. How is it spreading? Many coronaviruses can spread through coughing or sneezing or by touching an infected person. Scientists believe the new virus can spread from person to person in close contact through the respiratory tract. Masks can block large droplets from sneezes and coughs. They can also stop people from touching their mouths and noses, another way to stop germs. Experts say the best way to avoid getting sick from any virus is washing hands with soap and water. I don't know, guys. Doesn't that seem a little crackpot to you? That all you have to do is wash your face and hands? I mean, that's supposed to fix it?